to get that shot. Well, those people have already gotten it now. And now we knew that we're going to be in a bit of a grind, which is where we are, getting from that first 30%, 35% up to the finish line of 70, whatever we're shooting for, has been tough and will continue to be tough. I will say, and this is just my opinion, there are two groups that we struggle with. One are communities of color, for a lot of reasons, trust issues, the terrible history with the, Tuskegee experiments are still alive in the minds of many. And so that across the country, it's been slower to get the numbers there than we'd like. The other area is actually white evangelical sort of conservatives are also have been slow to get the vaccine. And that's probably more for ideological, maybe even political reasons. I don't know how we attack what in some ways are opposite ends of the political spectrum, ideological, socioeconomic spectrum. It'll take different strategies. With regard to communities of color, we made a decision to engage the services of a group called The Movement to go to, frankly, do some door-to-door in targeted neighborhoods and communities of color. And again, this is my opinion. I don't know that has worked as well as we wanted it to. I think there was good intent. But in terms of results, I don't know that the movement has done very well, which might sound harsh, but as we decide how we should be, appropriating our resources going forward, we probably need to think about a different strategy for communities of color than what we had been using, because I think there's a lot of sizzle with the movement, not a lot of steak, as they say, and our numbers just aren't moving. So it's some organizations, they talk a lot and don't deliver as much, and that's okay. But we just need to do better. So certainly before we would make the mistake of investing more in a failed effort, we would want to, we'd want to rethink that. But regardless, at the same time, we knew this was going to be hard. We knew it was going to be tough. And so we have to continue grinding it through so we can get those percentages to where they need to be. So, Sean, that's all I have at the outset, at the top. I guess some good news, some less good news. And this just seems, with the Delta variant staring us in the eyes, that this was a good time to kind of take an inventory of where we are and decide where we go. So thank you.
Yep. Thank you, Mayor. And now we have a very timely infectious disease physician with us who knows a significant amount about the Delta variant and what challenges that this will be for the community. And so I'm very fortunate to have Dr. Kammeier from UTMC, and he is assistant professor of the Toledo College of Medicine and Life Sciences. So we're very blessed to have him, very well respected. And with that, I'll turn it over to Dr. Kammeier.
Sean, thank you for the invitation. Are the slides available? Or am I sharing them from my computer? Aha. Good. Okay. All right, so I'm going to try to get through about 11 slides in about 10 minutes. And I wanted to just start by setting the stage for where we're at right now. This data is from today. So over the past 7 days in the United States, there have been 26,000 cases of COVID-19, which represents a 69% increase from the previous 7 days, which had 15,500 cases. And so, through the end of June and early part of July, we had started to see a little bit of a lull in cases compared to where we had been with the most recent surge in cases, which had happened in April and early May. And now it looks like the numbers are going in the wrong direction. Hospitalizations are also increasing. So far, the number of deaths have not increased, but we do know that deaths do tend to lag hospitalizations. And it may be the case that we have improved treatments and we won't see as many deaths as we had seen in the previous surges. It's also the case that now that we're seeing younger persons who tend to not be immunized that are coming into the hospital. And because they tend to be generally healthier, perhaps we won't see quite as many deaths with the forthcoming surge, but this is where we're at the moment. So, next slide, please. All right. And so in December, India had what was really, I think, the fourth variant to kind of come to the forefront of COVID-19. And so it wasn't really identified in large part until March, but I think that we had all seen in the news that India had just really a catastrophic surge of cases in March and April that really left India in a very difficult situation. Sequencing has suggested that the very first Delta variant probably was back from December. And when we talk about variants, what we're really talking about is a change in the structure of the protein of COVID-19 that promotes increased transmission. For our purposes, that has the effect of having an increased fitness of virus. And if this particular variant is more transmissible than other variants, then this is the variant that will become the dominant strain in the community. In the United States, the first case was really identified in the middle of April. And as of yesterday, Rochelle Walensky had said that the Delta variant is now 83% of all COVID-19 cases in the United States and is certainly the dominant variant, which is certainly different from even just a few weeks ago. Next slide, please. So is the Delta variant more contagious? Well, I cite here that there was a case control study that was performed in the UK in which they looked at household clusters of patients that had COVID-19. And they determined through genomic sequencing that the Delta variant was about 1.64 times greater among the Delta variant cases. And now they compared that with the original Alpha variant, which was also known as the UK variant. And that Alpha variant was already about 50% more contagious than the original wild type virus. So, we're now looking at the Delta variant, which was about 1.6 times as contagious as the Alpha variant, which is why the Delta variant has become dominant in the UK about a month ago and is the dominant variant in the United States now. Next slide, please. So a more recent study, this is actually out of China, suggests that the Delta variant does spread 2 to 3 times faster than the original wild type virus. Again, that makes sense. That corroborates the UK data, in which it was 1.6 times as contagious as the Alpha variant. And the reason for this is probably because the Delta variant appears to grow more rapidly inside the respiratory tracts, and it also grows to much higher levels. And so on the order of, there are 1,000 times more copies of the virus in the respiratory tracts and in the nasopharynx compared to the wild type virus. And it really takes about 4 days for the Delta variant to reach detectable levels, which is a little bit faster. It's generally about 6 days for the virus that we were dealing with in the US in December and January. So next slide. We know that our monoclonal antibody treatments are at risk here. And so there has been extensive study of the monoclonal antibody therapies and have shown that with certain mutations to the virus, these become less effective. For the Delta variant, the mutations that make the Delta variant more contagious have not yet shown a change in susceptibility. But, we are concerned that we're probably not going to see quite the efficacy for some of our monoclonal antibody treatments with the Delta variant. Now, the Delta variant is certainly more contagious. Whether it actually leads to more significant disease severity is not quite yet known, and those studies are underway. But certainly, if there are a lot more people that are infected in the community, there's going to be a lot more hospitalizations and more deaths, even if the variant itself doesn't lead to more severe disease. Next slide, please. I'm going to present some of the data regarding the question of whether the Delta variant leads to less vaccine efficacy, because there's a little bit of controversy around this. So there's 3 studies. First, in the Lancet, they were actually looking in Scotland to determine whether the Delta variant was evading the vaccine protection. And so they looked at the AstraZeneca and the Pfizer vaccines, and they really didn't have enough numbers to kind of quite compare, but they were able to demonstrate that it probably appeared that they were both a little bit less effective. They compared these to the Alpha variant and demonstrated that, after one shot, after the first vaccine dose, that the efficacy was not quite as good as it was with the Alpha variant. But really, after 2 doses, it seemed as though that the vaccines held on just fine. Next slide, please. There's a separate study that was done by Public Health England that showed that, again, one dose was about 17% less effective at preventing asymptomatic illness from the Delta variant compared to Alpha. But again, only a small difference after 2 doses. And so they had determined that the Pfizer vaccine was still 96% effective against Delta variant after 2 doses, and that the AstraZeneca vaccine, which of course is not available in the United States, was 92% effective. Next slide, please. There's also Canadian data that really mirrors this. They looked at Pfizer and Moderna, and they demonstrated that, again, there was probably a little bit of a decrease in the efficacy after partial vaccination, but with full vaccination, that the Delta variant, there was efficacy that was comparable to the Alpha and the other variants that had been out there. And so, still good confidence after these 3 efforts to evaluate the vaccine, that the vaccines were going to hold on pretty well. Next slide. But then we've probably all seen in the past couple of weeks that there's been conflicting data out of Israel. Now, Israel is unique because Israel has a high proportion of fully vaccinated persons. And they had an outbreak recently in which they determined that about half of the patients that were infected with COVID-19 had been fully inoculated with the Pfizer vaccine. So they had this big, Delta variant outbreak, and half of the patients had been vaccinated. And so their claims have been that the vaccine was 64% effective in prevention in the prevention of infection, but still 93% effective in preventing serious illness. Next slide. So we should emphasize that we don't have the full data from the Israel study yet. There are some concerns out there about how this study was performed, and that they may have not ruled out confounders. In particular, Israel has an excellent surveillance system, but they tend to only test people after they've had contact with a known case. And so there's been some criticism that the Israeli study may have selected for people who were already more likely to be positive, and that we may not be seeing truly an effect of whether the vaccine was effective or not. Next slide. And so finally, I think our take-home points are that all of the studies show that there is a decrease in prevention of infection. All of the studies show very high decreases in the prevention of hospitalization and death. And we should understand that, preventing illness is good, but what we're really after is making sure that people don't get serious illness, that they don't end up hospitalized. And we're, of course, trying to limit that. And so, those are the take-home points, and I'm happy to take any questions about the Delta variant. So there's a question of the UK reports 40% after vaccination hospitalization rate. So the question here is that the UK is reporting that, just want to understand the question adequately. I'd have to know exactly what you're referring to. So patients that have been hospitalized, that those patients, that they're seeing on the order of about 40% of their patients that have been vaccinated if they're hospitalized. I haven't seen that reported and wouldn't really, I think, be able to respond to that.
If anyone would like to ask a question, you can use the raise hand feature to raise your hand, and then we can call on folks to ask questions. Or you can continue to put them in the chat.
Sure. All right. How many individuals who have been hospitalized have been and are infected are vaccinated? I think that's the question. So I haven't seen UK data, but certainly in the United States, the trend has overwhelmingly been towards that this is becoming an epidemic of the unvaccinated. It is profoundly rare to see vaccinated persons that have developed severe disease, and deaths are almost unheard of among the vaccinated patients. And so in the United States, and this is reported throughout the US, including locally and certainly in the pockets in the southeastern and southwestern United States right now, that the overwhelming majority of patients that are hospitalized haven't been vaccinated.
Okay, we have a question from Richard Epstein. You can go ahead and unmute yourself.
Well, I wrote my question also. How long does the vaccination work? If we were vaccinated in January or February, could the disease resistance be wearing off?
Yeah, that's a great question. So last night, there was actually a town hall in which Matthew Hepburn, who is the project lead for Operation Warp Speed, was presenting. And so he was also the commencement speaker for the medical school a few weeks ago. And I asked him this exact question. At the highest levels of the United States government right now, where they're working on this, the most compelling question is really, when are we going to need boosters and how many boosters are we going to need? And so this is probably the most important question that's being evaluated through research right now. And so really, it seems that, the preliminary question, the preliminary thought is that a booster is likely to be needed. There may be a need for another booster after that, but there's a sense of optimism that this may actually not require boosters yearly like the influenza vaccine. So this is not known. We're not going to know until the research is done and that people are evaluated for how long their immunity is lasting. I think we can anticipate that there will be at least one booster. There may be more, but more to come with this.
Our next question is from Roxanne Elias with WTOL. Roxanne, you can unmute yourself.
Hey there, doctor. Obviously there's still a lot of people out there that are just very adamant that they will not get the vaccine. And then there's others that can't get it for health reasons. What would you have to say to those that just have made up their mind 100% that they're not going to get the vaccine? Because we've heard over and over again, that's the main issue there. But what would you have to say to those people?
Right. I would echo the mayor's comments at the beginning. Trying to reach those that are determined in one way or another, that have their minds made up otherwise, I think is something that's vexing myself, Dr. Fernandez, really everyone in the community. We're not done with this. And I so wish that we were. I'm as tired as anyone. But, we have had patients that we have, even within the last week, unvaccinated, developed severe disease, had to be transferred. A patient recently that had to be transferred to another institution because they were just doing so very poorly. I think that the data is pretty clear that the vaccines are our way out of this. And the severe cases, they're not as many, but they continue, and we are not out of the woods by any means.
I see Dr. Fernandez also has his hand raised. Doctor, did you want to jump in here?
Yeah, I just want to go back to that question that was just asked. I've been in the outpatient setting this week, and we do have in my pulmonary practice multiple patients, very few, but that refuse to get vaccinated. And when I ask them why, a lot of them say, well, their primary care doctor or their dermatologist or the nephrologist said, well, they don't feel it's needed, that we need more data. But when I actually asked them, say, oh, well, I know your doctor. Did he really say that? And they said, well, no, they actually said this. So it's very important for doctors to have a message that is very blunt, very direct, and very simple. Like Joel said, vaccination is our way out of this mess, and the vaccine is safe, and the vaccine is effective in preventing serious illness. I tell my patients, you can still get COVID, but you will not be in the ICU. And I think if all the doctors, whether they're dermatologists or radiologists or nephrologists, have that same message, it will be less confusing for patients, and they'll be less able to weasel out and say what they want to say. Our messaging is very important, and quite frankly, I think as physicians, it's been ineffective, and we can do better.
It looks like there is also a question in the Q&A from the Fair Housing Center. It says, do the original risk factors for a severe COVID outcome, obesity, high blood pressure, heart disease, diabetes, etc., still apply to fully vaccinated people who contract COVID? Put another way, if you were at an increased risk of a severe COVID outcome prior to being vaccinated, are you still at risk of a severe COVID outcome after being vaccinated?
I would suggest that those are two different questions. It is really the case that in patients that are vaccinated, that severe COVID-19 is profoundly less common. I'm a little hesitant to say that it doesn't exist, but patients simply don't end up in the intensive care unit, and they hardly end up hospitalized, even if they end up with COVID-19. The other risk factors, it certainly is the case that persons that are older has been the predominant risk factor, even more so than obesity and diabetes and so forth. Even among those age groups, we're still seeing the same protection for the vaccines, and those people do much better. We should understand that in the United States, the number of persons that are age 65 and up that are fully vaccinated is greater than 80%. And so this has become a pandemic now of younger unvaccinated persons. Even persons with significant risk factors do very, very well once they've had the vaccine.
Any other questions at this point? I want to thank you, Doctor. I think very timely, excellent presentation. I think it's very informative and really up to date, like as of today. So very helpful. Thank you.
It looks like we do still have 2 hands up right now. So I'm going to allow Tina Butts to ask her question. Are you there, Tina?
Yes, ma'am. I'm here. Thank you very much. Just to piggyback or talk about, what the mayor and how he felt that what we did, I think is more on a personal note, or what he felt to believe that's happening out here. in this politic election going on. And I know that he is really, being derogative and coming to ruin our names and things like that. But what's important is the fact of saving people's lives. We're not no longer, and we were no longer with the V Project. We have continued to book appointments. We got vaccinations, that mobiles that's going on last weekend, this weekend. Our numbers have skyrocketed since we joined the V Project, but for him to come at us, in the magnitude that he's trying to come at us and, put our organization down because he feel that we's in support of someone else is not fair to our community, nor to myself and our organization. So with that being said, Sean, we had continued to work. I have emails that have been given to the mayor's office along with myself that the numbers were above what the expectations was in Lucas County and Wood County since we came aboard. So we're going to continue, like I told Sean, that we're going to continue out here to do the work. We were doing the work before we came along with the V Project. We was only on board with them for a few months. So, as far as they go, we have been out there all day today, out here all week last week, and our date ended with the V Project in the beginning of July. And I really feel that it is a very cheaply blow. He should keep his politics away from the lives of what's taking place out here in our community. We continue to be out here all year round. We started out, we had a humongous fight trying to get vaccines to our Black and brown people in the community, and for somebody that leading our community to come at somebody like that, it's very disappointing to us. So, with that being said, Sean, we are continuing to work with y'all, even though we're no longer doing payroll. Our numbers don't lie. So sometimes you have to go and look at the data and what we reporting and what's going in and how we getting people and taking them over to the vaccines in our cars. So I just wanted to be able to have an opportunity to speak our part. We done had 13, 24/11 going out here door to door with us, and no matter what, or how he feel against our organization, that's not got nothing to do with us trying to save people's lives out there. I appreciate y'all letting me speak. And I have data and facts. And Sean and y'all have turned over an email. So it's just something personal, but he could left that, for a later day or gave me a phone call. Thank you.
Joel?
I'd love to respond because as you explain what your group is doing, it reminds me a little bit of 2014 through 2016 in West Africa. And I have spoken with, I've got a couple of colleagues that worked on the prevention programs for Ebola in West Africa in 2014 to 2016, and that worked in Liberia and so forth. And, there is, in any situation like this, a group of people that will immediately participate in whatever preventative options are offered. And there's a group of people that are hard to reach, and they're just hard to reach. And I think as we look back, I think as we look back at the past 16 and a half months that we've been at this, there's frustration everywhere that you turn if you care to see the frustration. But I have to say also that, every single patient that's vaccinated, every single human that's vaccinated, I look at as a human that might not end up in Carl and my ICUs. It was December 8th this past year where our census hit its highest number. We had 249 patients on our census. And every single person, if had the vaccine been available, they might not have been a case on our service back on December 8th, which was the peak that we had locally, at least in the hospital. So, the little victories are still victories. And I think that we just all need to recognize that, as we're looking back at the last 16 and a half months and as we're looking forward to. But thanks for letting me respond.
Carl, and then we'll go on to, we gotta move on to committee reports in a moment.
Yeah, one last thing that I just want the panelists to realize, and Joel knows this, is that prevention is critical. I mean, once they get into the hospital and into the ICU especially, it's a luck. It's really lucky if they're going to survive or not. The medications that we use, steroids, remdesivir, et cetera, by and large, you know, they're ineffective compared to the prevention that the vaccine offers us. And I think that's part of the messaging that we really need to get out. Joel also mentioned the evangelical Christians, and I don't know if there's anybody from the Diocese of Toledo on board, but there's a group of conservative Catholics also in certain parishes that just won't accept it, and that's very, very hard to also overcome. And I know in certain parishes they're very welcoming, and in other words, where there's some a little bit of hostilities, confusion, etc. It really depends on the priest. So the 2 points I want to make, it's not just the evangelical Christians, there's also a conservative Catholic movement. And also prevention is critical, and we got to get that in our message, because once you get in the hospital, nothing works well as well. Thank you.
Yep, thank you, Carl. So we're gonna move on to the committee reports, and the Marketing Communications Committee. I know Michael Say and Chris Peterson are gonna participate. Welcome.
Thank you, Sean. Appreciate it. And I get to talk about some of the good high numbers. As a committee, we were tasked with getting the message out to all residents in Lucas and Wood counties. And unless you lived under a rock, I'm confident everyone in both counties at least experienced or engaged one of our messages. And today I want to provide just a consolidated report on those activities and the giant numbers we were able to reach with the help of the fine folks at Cooper Smith. So in just 3 months of mass media campaign, and that's April, May, and June, we covered TV, radio, newspaper, digital, and transit with a total budget from dollars raised of $123,569. For broadcast TV, we hit every local network with both Buckeye and Spectrum on cable. And not only did these outlets air our paid spots, but they also threw in an additional 50% placement gratis. Because of this activity, the wonderful creative, and the commitment by everyone, we were able to reach over 7.2 million impressions by folks over the age of 18. On radio, we achieved over 3 million impressions utilizing the airwaves of 10 stations via iHeart, Urban Radio, and Cumulus. They also stepped up, more than doubling the amount of paid placements we had at no charge. In print, we showcased ads in the Toledo Blade, Toledo City Paper, La Prensa, Sojourner's Truth, and the Toledo Journal. That had an over 1.3 million impressions it generated, and it went beyond print, as many of them also featured our message on their digital and social properties. And speaking of digital, we were everywhere. So both English and Spanish versions of our creative spread through the digital world to reach over 5.2 million impressions. And finally, we hit the streets with media on buses and bus shelters across the area, netting another 2 million impressions. So to sum it up, the over 18 million impressions we made were made by the numbers, also made an impression on the public. Combine this with the media that was donated on digital channels of so many of our participating companies, on their digital signage networks, and the donated space on billboards, and you're looking at one of the most powerful campaigns I've seen locally. One that is only going to be achievable when donations, media, companies, and committed individuals come together. So V Project as a whole should be very proud of these amazing accomplishments. Thanks, Sean.
Thank you, Michael.
And then on top of that, everybody, we've had amazing support by all of our area media outlets when it comes to news reports. And there has rarely, I can't even think of one, been an event that the V Project has been involved in that hasn't been covered by our local news television stations, radio stations, and newspapers. So just wanted to say thank you to our media, because not only were they giving us added value in the spots that we purchased in those placements, but they also have been covering our events and helping us to spread the word and raise awareness, and covering the very big importance of this project and trying to get everybody vaccinated in Lucas and Wood counties. And even though we are focused on Lucas and Wood counties, their reach is farther than that. So there's no doubt in my mind that with the extra media coverage we've been given and the news coverage that we've been given, that we're also making an impact into the other counties in Northwest Ohio as well. So
Thank you very much, Chris.
I just want to say thanks to our reporter friends.
Thank you, Chris. Thank you, Michael. Great work. Really appreciate it. And it will continue. The healthcare providers with Peter.
Hello, everyone. How is everybody today? Just wanted to let you know that on Monday, June 14th, we had a Facebook Live event with 6 providers providing their personal views and answering questions. We had excellent feedback on that. We think it went very, very well, and look forward to possibly doing that again. We also have been pushing out information for questions and answers for providers to be able to answer in their offices, placing information in the offices as well. Patient responses have been kind of along the lines that Carl mentioned. We still have those that are very hesitant in getting it, and some that absolutely refuse. Supply and demand along those lines, we have an excellent supply. Demand, unfortunately, has fallen off. The mayor kind of mentioned that a little bit, but we have an excess supply currently with provider offices. We would like to have more demand and get more vaccines in arms out there. Thank you. Carl, would you like to add anything?
No, you did pretty well, summed it up. I think we just as providers, we need to just get a message out, all it should be the same thing if we can, and just be very blunt about it.
Great. Thank you, Sean.
Yes, thank you, Peter. So we have the business and industry with Doug Liedberg.
Yeah, good afternoon, everybody. I'm Doug Liedberg, one of the 3 co-chairs of the Business and Industry Committee. The committee's other co-chairs are Wendy Gramza and Christine Castellano. Our committee continues to have active participation from over 75 organizations across our community, and we continue to meet at least every 3 weeks. In terms of focus, we continue to stay closely aligned with our liaisons, with the Marketing and Communications Committee, the Logistics Committee, and as needed, other committees. We continue to leverage other area organizations to really tap into and leverage their expertise and resources. And you can see some examples here on the slide: the regional chambers of commerce, Better Business Bureau, the legal community, Rotary Club, just some examples. We also continue to support private employers with their on-site vaccination efforts, although those activities have slowed, at least for the time being. I would highlight the great collaboration we've had, and frankly, the great work by the Toledo Regional Chamber of Commerce. They've just done some outstanding work organizing a series of panel discussions with a range of area experts on important topics related to COVID-19, vaccination initiatives, and other return to work issues. Unless there are any questions, that is my update. Thank you very much.
Thank you, Doug. Really appreciate it. Appreciate the work of the committee. You guys have been excellent and continue to get together every 2 to 3 weeks and continue to move the process forward. So thank you very much. We now have the K-12 committee report from Dr. Tom Hostler, Perrysburg Schools.
Thanks, Sean, and welcome everybody. Just on behalf of Romulus Durant and Lynn Casto, our co-chairs, just an update. We were very active at the end of the year and even in the summer with holding vaccination sites at many of our facilities across Northwest Ohio. And that is something that we're looking to resume once we get back to school. We know that summer's in session right now, so that's kind of a hard time to reach our parents and teachers and get everybody together. But August 1st is the first day of high school athletics. That really marks the end of the summer and it begins to get people back into schools. You'll hear from schools now beginning to talk about their plans in terms of back to school and what that means. And we want to make sure that we're continuing to focus on the importance of, being vaccinated. As we plan, what decisions, just for example, in Wood County, 79% of the eligible residents 12 and up in Perrysburg, for example, are vaccinated. And so that is a great sign, and we're beginning to see those kind of results in other communities. And, so we're beginning to plan for that return to school. And we work with the health department's meetings last week and this week in the area. And, things have gone very well. A little bit of uncertainty with how we are to begin the school year. Yeah, if you followed the news, we saw the CDC, the American Academy of Pediatrics, issue statements about the use of masks. House Bill 244 was signed by the governor, which restricts school districts from discriminating against students that are not vaccinated. So there's some uncertainty as to what that actually means in our daily operations. And Senate Bill 209 was introduced. That won't get heard until after the start of the school year, but that is a bill or a law. It is a bill that was introduced to prevent any public schools or public universities from requiring masks, period. So we've got a little bit of fog in terms of how we roll out, but the vaccines are certainly the one focus that we all can agree on. So, but we're looking forward to continuing the work. So thank you, Sean.
Thank you, Tom. Appreciate it. The schools have been excellent, great leadership. And I know the school staff, in terms of a category, in terms of vaccination percentages, are as high as there is in any profession. So thank you. The Minority Health with Greg Braylock.
Hey, Sean, thanks for the opportunity to speak real quickly. I think just to sum this up, I feel like our community has thrown everything at this that we have, the resources under our disposal. So really, I just want to say thank you to everybody that committed their time and effort to trying to help us accomplish a really bold goal within our community, to get 70% of people vaccinated. If we look at some of the numbers in our Hispanic Latino community, they started off extremely low and have kind of soared to really high levels here in our community in Lucas County and beyond. And so when I think about people like Baldemar Velasquez, Sabina Serratos, Jessica Kuhlman, Dr. Pat, a host of others who have really targeted various parts of our Latino community to make sure people have access to vaccination information. I think about the health department, the commissioner's office, the city, other county offices that have just stepped up to help us really deploy a strategy where we targeted neighborhoods, tried to use data to the extent that we had it, to really look into communities and neighborhoods to try to make progress on vaccination and target our efforts. And then, individuals like Tina Butts from the movement, Juanita Green, many in our faith community who use their platforms to make sure people had information. I don't know how much more we could have done as a community to make sure that we got the word out, make sure we had access in our communities, which was key. And we gave people the opportunity to make decisions. I think hopefully we'll continue to see as this thing plays out nationally and obviously across the world as we begin to build infrastructure in our healthcare systems, where this is just like going to the doctor to get your flu shot or to get a refill on your prescription. People go and get their COVID vaccination over time. Hopefully we'll see kind of an uptick there, but really not much more to say, but thank you to everybody who's contributed their time, their voice, their effort, their social capital to help us push this in the community. One of the last things we're doing more from a communication standpoint is developing a Storyteller's documentary. And so Donnie Miller and Ken Elkins are spearheading this with a number of people to really help amplify voices of those who have been impacted by COVID, particularly in communities of color, so that people can hear from those who they might identify with and just hear how things are impacting individuals. And so I think that's something that we'll be able to use to talk health equity as we move forward as a community, but also hopefully with the time and the resources we have left to continue to push the message.
Yeah, thank you, Greg. Minority Health Committee has been critical. One of the key emphasis with the V Project from the beginning is to make sure that we try to reach everybody. that we make vaccines something that's not just for those that have an easy way to access, that we really try to do everything possible as a community. So at the end, everybody could say they had an easy opportunity ultimately to get vaccinated. And everybody has to make their individual choice and decision ultimately. But thank you very much. And now to the Finance Committee, Anand Patel.
Thanks, Sean, and thanks, Greg, and thanks everyone else that gave an update. Well said. So we've raised over $420,000, and we've allocated about 340 of that. We've had a lot of support from a lot of organizations in the community. We listed several of them here: the Movement, Cooper Smith, WGTE. You can read the list. We also want to thank all the donors. There's a list there to the right of all the donors that have contributed and supported our vaccination efforts. Going forward, the focus is going to be to continue to support vaccination clinics and other projects as they come up. And also just want to take a minute to thank Ken Elkins and the Toledo Community Foundation for providing the structure to track, receive pledges, to fund initiatives, to make payments. A lot of good work going on behind the scenes. And also thanks everyone for your patience. I know we always haven't been able to fund as quickly as some of the folks would like, but we definitely appreciate everyone's patience. So thank you. Sean?
Yeah, thank you very much. And the Finance Committee's done a wonderful job. I mean, it's a very professional group working in conjunction with the Toledo Community Foundation. Just really a home run in terms of how you've been organized and what you've done. So thank you very much. I'm going to conclude just with a few comments relating to the kind of overview of where we're at, and more importantly, where we're going. So, if you'd have told me back in November that we'd be where we're at today at the end of July, I would have thought that we'd be probably a little further along. However, I think the reason the V Project was formed was that we knew that there would be hesitation, that there would be challenges. If there weren't going to be, we wouldn't have needed the project. So as a project, we are going to continue to march forward, and we're going to do that until we hit the goals. So right now in Lucas County, 47.63%. I think it's a little bit higher today. Wood County, 52.53%. If you do a mathematical equation, it combines to 48.85 versus weighting on the populations in the two counties. And the state average is 48.41. So the two counties that we're serving with the V Project combined, they're above the state average. They're both, I believe, in the top 17 of counties in the state out of the 88 counties in terms of percentages. So there's quite a bit to celebrate. There's quite a bit to feel good about. Our goal for the combined counties is to get over 50% in July. We think we'll hit that in the next 9 days. For August, we'd like to see Lucas County exceed that 50% threshold, Wood County get over 55%. And then, I guess the open question is, can we get to 70% by January 1st of 2022? So time will tell, but we'll continue to make the effort. With our resources that we have, kind of the strategy moving forward, it's interesting to look at data and look at polling, because there's a great divide right now with different ends of the political spectrum as it relates to vaccinations. However, the one common, when you look at the polling data, the one area that there is commonality along the whole political spectrum in terms of respecting the source as it relates to vaccinations is physicians. So we're going to spend a lot of energy over the next 3 months on leading with our physicians and having our physicians reach their patients, not just in appointments, which is important, but also through other means, videos and other ways. So we're working in conjunction with all the major healthcare organizations in town right now at developing a plan and a strategy around that. And so I'm excited about it. I think it could really help because physicians are trusted, and we need to tap into that to kind of get to the next step. Also, key gathering places and events. If you go to a big event around, there's a high likelihood you're going to see a vaccination clinic, and the health department's done a wonderful job. And we're trying to partner with them, providing support for that. Just being where the people are this summer is key. The back to school campaign is going to be extremely important over the next 30 days. And we'll be there to support that and try to help in any way we can as a project. The Metro Parks has stepped in significantly this summer. We're very excited about their involvement. They're running vaccination clinics. And I think that it's actually through mid-August at this point. Their first one started in July 11th, I think was the first one. And they're going to be running them at various parks and using their contacts to get folks out to be vaccinated. So we really thank the Metro Parks. Also, Paramount is working in conjunction with the state to support vaccinations for the Medicaid population. So there's significant energy and effort being put in there, and we're there to support that as well. Also, we're hoping at some point we do get the FDA full approval, and not just for emergency use. If and when that happens, we will be there to really trumpet that, because we know there's folks that are waiting for that to make the decision on vaccination. Also, for children, we expect in the fall for ages 5 to 12 to open up, and we'll be there to support the efforts of our pediatricians and schools in those efforts, and educating parents. The COVID-19 cases are on the rise, as has been stated today. And so really the V Project, our efforts just need to continue to ramp up and move forward. And I'm confident we will. I'm really extremely appreciative of everybody's involvement and effort as we continue to march forward. So the funding, we still have funds, and we've been trying to be very smart in deployment, so that as we get into the fall, we still have resources to support the efforts that are being made. So if you know folks that would like to continue to support the V Project, this slide shows you how to do that. So I know we're running late. We just hit the 1 hour exact, and so we are going to close the meeting. But thank you very much. Thanks to everybody for everything they're doing, and let's keep pressing forward as a group. Thank you very much.
Thank you, Sean.
Thanks, Sean, and the rest of the committees.